Hey everyone, and welcome. Today, we're going to dive into a topic that affects millions of families all over the world, but honestly, it's often really misunderstood. We're talking about congenital heart disease. So to get us started, let me ask you a question. When you think about birth defects, what's the very first thing that pops into your head? What do you think is the single most common type that babies are born with? The answer is actually a big surprise for a lot of people. It's congenital heart disease, or a CHD for short. And get this, it affects about 1 in every 100 babies born across the globe. That's more than 1 million infants every single year. So this isn't some super rare condition. It's the most common structural issue a baby can be born with. To help make sense of all this, we're going to break it down into 4 simple parts. We'll start with the absolute basics. Then we'll look at the causes and the different kinds of CHD. After that, we'll get into how it's diagnosed and treated, and finally, we'll talk about what it actually means to live a full life with it. Okay, so first things first, let's build our foundation. What exactly is congenital heart disease? Let's just break down the name because it tells you almost everything you need to know. Congenital, that just means it's present at birth. And heart disease, in this case, means there's a problem with the heart's actual structure, its physical build. So CHD is really just an umbrella term for any kind of structural problem with how a heart was formed in the womb. You know, to really get a handle on what can go wrong, it helps to think of the heart kind of like a house, a really efficient house with 4 rooms, those are the chambers, and 4 really important doors, those are the valves. And these doors are designed to make sure blood only ever flows in one direction. And the plumbing in this house is, well, it's brilliant. It's designed for a super specific flow. So you've got blood that's low on oxygen coming into the right side. From there, it gets pumped next door to the lungs to pick up a fresh supply of oxygen. Then that oxygen-rich blood comes back into the left side of the heart, and bam, it gets pumped out to the entire rest of your body. It's this simple, elegant, and absolutely vital loop. So that's the blueprint for a healthy heart. But what happens when that blueprint has a mistake in it somewhere? Let's dig into the causes and the different types of CHD. The very first question families almost always ask is why? What did we do wrong? And the honest-to-goodness answer is that in most cases, we just don't know. For the vast majority of babies, there's no single clear reason why the heart didn't form perfectly. It's almost always just a random, complex event that happens during development. Now, that's not to say we don't have any clues. Researchers have definitely identified some risk factors that can increase the chances. Things like certain genetic conditions, or if the mother